Galleria Podiatry here. I've got Rachel with me today and we're going to talk to you a little bit about flat feet. So two of the most common questions that we get asked in the podiatry clinic is, have I got flat feet? And secondly, how does the flat feet affect my foot and my feet, but also the rest of my body as well? So Rachel's got a pretty classic example of what we call a functional flat foot. So this is where when we're in a neutral position, there's actually a pretty good arch here and everything functions okay. But when she's in her relaxed position, the arch becomes quite low and it becomes a flat foot. So to start off with, what I've done here is create a bisection line down the middle of the leg here. So I've started at the middle of Rachel's knee cap here, and I've extended that line straight down the shin bone, down the middle of the leg, straight through the front of the ankle here, or the subtalar joint as we call it, and then straight through the second toe here. So as Rachel is in this neutral position, this is the position that the foot functions most effectively in, most efficiently in. So in this neutral position, everything is in a nice straight line, as we can see, kneecap, straight down the shin, through the joint, and straight through the second toe here. But if Rachel goes into her relaxed stance position, into this position here, we can see that the arch gets lower, and now we can see that there's this big angle at the subtalar joint here through the ankle joint, creating this angle at the bottom here. So this is what we would call a classic flat foot. It is synonymous with a number of conditions that we see regularly in the podiatry clinic. So the first one of these would be under the arch here. We see a lot of arch pain and heel pain, or plantar fasciitis as we call it. Also around the inside of the ankle here can get really sore as these tendons and muscles further up get overused and stretched and strained. We also need to think about the Achilles tendon at the back of the heel here as well. Can also have a lot of stretch put on it and cause a lot of pain there as well. So as we move further up the body, the first thing that we see is the shins here. So shin splints is a very common condition that we see. Also growing pains in kids. This is the area that most kids will wake up in the middle of the night and they'll have pain at the front of the legs here. And that's because as the foot rolls across from this neutral position, these muscles at the front of the leg here have to work really hard to hold that foot up in this neutral position. So every time the foot rolls across, these muscles pull that foot back into shape. And that happens between 8,000 and 10,000 times a day because that's how many steps the average person takes. So this is a really common condition that we see. We always talk about good supportive footwear, maybe some orthotics as well, along with a whole bunch of other treatment modalities that I'll come back to in a second. So moving further up the body, we come to the knees. As the foot rolls inwards, one of the first things that happens is that the knee rotates internally. So I'll show you that one again. From neutral, looking at the knee, this one rotates internally. So already we've created this angle at the knee joint here, which means that the knee is not functioning in its normal position. So there can be wear and tear on the joint, on the cartilages in those areas. We also get a bit of stretch on the ligaments that hold the knee together in this area here, and often a bit of cartilage damage because these cartilages get squashed on the outside. We can also think about the patellar tendon, or this tendon that sits just under the kneecap here as well, which often gets overstretched when the knee rotates internally. Further up the body, we get the hips. So as the knee rotates internally, the hips rotate as well. So this is where, again, similar to the knee, the hip joint is not sitting in the right spot. So there's wear and tear at the hip joint. But also, as the hip rotates internally, it tilts the pelvis forward as well. So this is where lower back pain can become quite common. So I guess the moral of the story is that with flat feet, that can obviously affect the foot and ankle and cause pain down here, but it also has a marked effect on the knees, or shins, knees, hips, and lower back as well. So if you are experiencing any of these aches and pains, it's probably a good idea to come and see a podiatrist. Look, that's pretty much all I wanted to talk about today. If you have any questions, then please type them in the comment box below. Rachel or myself will answer those for you as soon as possible. And if you know someone who might benefit from seeing this type of video, then please share it with them or tag them in the comment box below, and hopefully we can help them out too. So that's about it for now. Thanks for joining me. We'll see you soon.
Everyone, it's Rachel here from Galleria Podiatry. Do you have sore feet? Well, here I want to talk to you today about footwear. Every day people come to us and ask us what sort of shoes they should buy to help their feet. They tell us that they've bought hundreds of pairs of shoes and none of them feel comfortable. Well, if that's you, I've got some tips to give you to help you find the perfect shoe for you and keep your feet feeling happy all day. So, the The first thing you need to look at is the heel counter, which is this area here at the back of the shoe. You want to make sure that the heel counter is nice and firm. So you shouldn't be able to push that in with your thumb. You can see here that I'm putting quite a lot of force on the back of the shoe and it's really not budging. So if you push the back of the shoe and the back of the shoe falls in, that's no good. We want this area here to be really nice and firm because that's what's going to support your ankle and keep your foot nice and stable while you're walking and moving around. The next thing to look at is what we call the torsional twist through the shoe. So you really shouldn't be able to twist the shoe too much through the middle here. If you pick up your shoe and you're able to basically wring out your shoe or twist it, again you're losing a lot of that support that you need from a shoe. When you bend the shoe should only bend across the balls of the feet, not through the middle of the shoe here. So again, we're looking to try and create the most support and stability through your shoe. Your shoe needs to have some kind of fastening mechanism. So whether that's a shoelace that you can adjust and secure your foot nicely in the shoe, or you're looking for a shoe that has a Velcro strap or buckle, something that you can adjust on your foot to make sure you've got the perfect fit. If the shoe is a slip-on shoe, so something like this for instance, you need to make sure that there's no gaps around your ankles and that the shoe's fitting nice and snug. When the shoe's too sloppy on your foot, your toes actually have to grip onto the shoe to hold to keep the shoe onto your foot. So that's really going to tire your feet out and make your feet, work harder than what they really need to. At the end of the day, the shoe should just basically stay on your foot without you having to do any extra work to keep that shoe onto your foot. So there's my helpful tips for finding the perfect shoe for you. If you have any questions about footwear, please comment below and I'll be more than happy to answer your questions. Hope you're having a fabulous Friday. Bye for now.
Lower back pain, and again let me say this, I'm talking about pain in your lower back that has not come from an injury or a herniated disc or a spondylolisthesis or some condition that is medically not connected to the biomechanics of the foot and lower foundation structures. I'm talking about back pain, and there's been a lot of research done in the last few years showing that the hard, flat ground we walk on causes our feet to pronate and collapse. And when your feet pronate and collapse, your knees internally rotate, which I'll show you on our physical model shortly, which causes a rotation or tilt in our pelvis. Now, a lot of people will say, I've got a dull ache in the lower part of my back, and I may have been to a physiotherapist, and the physiotherapist said, well, listen, go and strengthen your stomach muscles. Strengthen those muscles because it'll take the pressure off your back. I say this, it's good to strengthen your stomach muscles, and a lot of times they do need strengthening, but why are they weak in the first place? And why are the muscles in your back tighter, and why is this imbalance occurring? Let's not say you've got a tight muscle here and a weak muscle there and just balance them up. Let's ask ourselves, why are they like that? Generally, the reason is because we have a mechanical problem occurring which makes one muscle stronger and one muscle weaker. Now, you know this from going to the gymnasium. How many times have you been to a gym and the exercise instructor there says, if you want to do this exercise properly, do it this way? What is he saying? Unless your bones are working in the correct posture, you're working the muscles incorrectly so that you will cause an imbalance and possible injury. Now, in lower back pain, I have made so many orthotics, like I've lost count, to be honest. And when I first started making orthotics, I didn't treat back pain, I treated the feet. But everybody would come back to me and say, Phil, my back is so much better. And so after sort of doing so much work with the foot, I made it a point in my own head is to find out how do orthotics, in particular orthoheel, help with low back pain. So let's just go to our foot model and I'll show you a physical example of how this can occur. When looking at back pain, the most common area of back pain is in this low lumbosacral area here. And commonly it's not caused by an injury or an accident, as in certain cases. We're talking about low back pain and tightness due to simply poor posture of the lower leg, which affects the knee and the hip and therefore the whole pelvic girdle. Many times, as I said, the pelvis becomes loose, and as the feet roll inwards, it tilts the pelvis forward, which increases the curvature of the lower back, causing pain. Now, if Lauren wears orthotics or ortho-heel, we twist the feet out, it pulls the stomach area in, reduces the curvature of the back, and therefore balances up this lower area of her abdomen and back, removing this common cause of lower back pain.
Hi everyone, Rachel here from Galleria Podiatry. Summer's just around the corner and patients often ask us, what can I do with my orthotics in summer? I don't have any shoes that fit my orthotics and I can't continue to wear my sneakers or my enclosed shoes in summer, it's just too hot. Well, I've got Tom here from Paramed Australia, who's the owner of Paramed Lab, and he's got some exciting news to share with us all.
Yeah, thanks Rachel. What we were able to do with our Paramed technology is not only manufacture the patient's orthotics for you to fit into their sandals or their work shoes or their boots, but also we can then transform their orthotic prescription into a pair of orthotic thongs. So essentially the patient's orthotic made into an orthotic thong, which is custom fit with the volume of that patient's foot, with an Italian leather strap, fitted with an outsole in clinic on the outsole, which is non-scuffing, non-marking, able to be worn in the house, on the tiles, wooden floors, allows the patient to be at work, their sporting activity wearing their orthotic devices, weekends, at home wearing their orthotic thongs to ensure they're getting the maximum amount of control and support and comfort.
How awesome is that? So that's right, you heard it. We can make your custom made orthotics into a thong. You can pick the colour strap that you like. There's all sorts of different variations that we can do. Problem solved, guys. Summer is sorted. Any questions, please comment below and we're more than happy to answer them for you. Have a great day. Thanks a lot. Bye for now.
G'day everyone, it's Nick at Galleria Podiatry here. Look, today I've just seen a young girl who came in with knee pain, and I was trying to explain to her how lower limb and foot function can cause knee pain. So I thought I'd try and explain it to you as well. So most commonly we would see knee pain with kids and adults who have got flat feet or the feet are rolling towards the inside. So that'll definitely be the most common type. So what tends to happen at the knee joint? First thing that happens as the foot rolls inwards is that the knee joint rotates internally and moves towards the midline of the body. So we end up with this angle at the knee joint. So when we look at the joint as an internal structure, essentially what we're doing is going a little bit like this. I'm probably exaggerating it a bit, but it will give you an idea. So we're creating this angle at the knee joint. So as you can see here, we're going to get some wear and tear on cartilages on the outside of the knee in this area here because of the pressures. But also you can see I've overstretched this one too often and demonstrated this one a lot. But ligaments on the inside of the knee can also get overstretched and become really sore in this area here. One of the most common conditions that we see is patellar tendonitis, both in adults and kids, particularly those that are really active. So that's where we get pain just under the kneecap in the tendon that holds the kneecap in place. So that's firstly because of this angle here. So there's a bit of a bend in the patellar tendon here, which means it's got to stretch further, which means it's tighter and it's more prone to being injured or microscopic tears. The second aspect to this is that with this angle, the kneecap is not sitting in the right spot and it's also being pulled in the wrong direction, so you can get wear and tear under the kneecap as well. So yeah, quick explanation for you about how foot and lower limb function can cause knee pain. Look, if you've got any questions or comments to make, pop them in the comment box below, or if you know someone who is suffering with knee pain, by all means share this video with them or tag them in the comment box below. Hopefully that helps you out. Until next time, take care, see you soon.
Before the blue dye can be applied to the nail, it's important that we thin the nail down as much as possible. This is painless. We use a burr to do this. We use a blue dye to make the fungal cells sensitive to light. Fungal cells are different to human cells because they have a cell wall. A special blue dye that we put on makes them sensitive to light, which causes the cell walls to break down. And this is what destroys the fungal cells, but is completely harmless to the human cells. So the blue dye we place on the nail is quite intense in colour, and it needs to be left on for about 10 minutes to any of the affected nails. Once this has had a chance to stain the fungal cells, we can then apply the light. And the light will be applied for 9.5 minutes for each nail. Once the blue dye has been left on for 10 minutes, we can then use the light from the PACT unit. And this introduces light to the subject at a particular frequency. And it's 9.5 minutes we apply it for. It's painless and it's completely harmless to human cells as well. But these sensitised fungal cells will now react to the light. It gets placed over the nail. Now it's just a case of being patient and waiting. This process is repeated 3 times in the first week. It's important that it happens 3 times in the first week to get the most benefit from the treatment. And then after 3 months' time we can review again, at which point hopefully the nail will be showing signs of clear, healthy regrowth at the base of the nail. More severe cases of fungal nail infection may require monthly treatments, and you'd be looking for about 6 months for resolution. So that's the first treatment completed. We'll have 2 more treatments this week for the first cycle. And then we'll review this nail again in 3 months' time. So, quick, painless procedure.
Phil, I understand heel pain is the #1 foot pathology. Specifically, you're going to tell us a little bit about plantar fasciitis.
Yes, that's correct, Bruce. If we look at this picture here, we'll see the common area of pain is underneath the base of the heel. And the common term medically is plantar fasciitis, which means inflammation of the plantar fascia, but more at the base or the origin of it. What patients normally complain of is a pain that initially can occur on rising, whether it's getting out of bed in the morning or sitting down for a long period of time, then standing up quickly. What happens is they get a sharp, piercing pain underneath the base of the heel, much like a stone bruise. They tend to hobble around for a few minutes and then the pain seems to disperse and go away. However, if they sit down or lie down, the next morning it occurs again. Now what happens here, I say to a lot of people, when you're in bed lying down, your foot is actually in a relaxed position. Your arch has no strain on it, and we all know medically that the plantar fascia runs from the base of the calcaneus, the tibial tubercle, runs up to the forefoot and splits into the 5 metatarsal areas like this. Now if you're in bed like this, the plantar fascia is much like a bowstring. There's your bow, and the fascia forms the bowstring. As soon as you get up in the morning, you put all your weight on your foot tends to pronate excessively due to the nature versus civilization aspect, and when you collapse the mid-tarsal area due to excess pronation, it creates a massive force over the origin of the plantar fascia. If you look at the foot, you'll see most of the weight runs over this rear section, so you get the detachment at the heel, not in the middle of the foot or in the front of the foot.
Attractional force you're talking about.
Exactly. So you sit down, your foot is relaxed, you stand up, bang. And the trick is here is when you stand up in the morning or you get out of bed, I caution patients to get out of bed very slowly, because as soon as you get that pain, you've ruptured microscopically the plantar fascia. You get bleeding into that area, and then later on, you're not breaking the cycle. So what I advise is the use of an orthotic, or even better, a sandal beside the bed, an ortho-heel sandal, say, or some product that is orthotic in respect, so that you don't get out, collapse the foot, and create that chain reaction day by day.
G'day everyone, it's Nick at Galleria Podiatry here. Look, today I wanted to jump live onto Facebook for you to talk to you a little bit about ingrown toenails, something that we see every day here in the clinic. All of us see plenty of them, and we definitely know just how painful they can be. You know, sometimes something as simple as the bed sheets resting on them at night time can be excruciating, let alone if you actually kick them on the couch or something like that. But the good news is that there are some things that we can do to help you. So basically, treatment for ingrown toenails revolves around either conservative management or a minor surgical procedure. So conservatively, what we're going to do essentially is just try to cut the edge of the toenail out. So if we look at this little picture here, you can see that the ingrown toenail is somewhere around this area here. So what we'd be doing is just cutting a little bit out of the edge here and trying to get down as far as we can so that we can get that bit of ingrown toenail out. Now look, if it's really sore, it's inflamed a bit like this one, we can give you a local anaesthetic. Now, don't be too scared of the local anaesthetic, the needle. It goes nowhere near that sore spot. It actually goes way down in this area here. So it's not going to be right in that sore spot. And to be honest, if they're done properly and they're done really slowly, it shouldn't be too painful for you. So look, most of the time with conservative care like this, the ingrown toenail will resolve itself. There are times, however, where the ingrown toenail will come back again, or it just never resolves properly. And that's when we start to talk about a minor ingrown toenail surgery. So what that involves is definitely local anaesthetic in the same area down here. So the whole toe will be numb. And then rather than going across on the angle like this, what we're going to do is go straight down in this area here. So the root of the nail, or the matrix, sits down in this area here. And we're going to go right down to the bottom here, under the skin. So there's going to be no stitches. And we're going to remove this section of the nail. Now it looks big on this picture, but it's only a couple of millimeters wide. So we remove all this part of the nail here. And that leaves a little bit of the nail matrix or the root exposed. And then we put a chemical there which kills it. So it means that this edge of the nail can never grow back again. Yes, there's a little bit of a gap in this area here for a few weeks, but that closes over really quickly and the nail ends up looking cosmetically perfect, just a tiny bit narrower than what it is at the moment. So you can see this picture here is one that's just been done recently. So a couple of millimeters been taken out from here, there's a chemical being put down the bottom here, and you can see that there's this little gap here, but that does close over in the next couple of weeks. So recovery wise, look, the recovery is really good with this sort of thing. It's only a minor procedure. So you might need to take a Panadol that night just for a little bit of throbbing when you go to bed, but no one really ever needs anything more than that. There'll be a bit of a dressing on it for a couple of days, but 2 or 3 days later, you take that off, or we take that off for you, and you get back to just wearing a band-aid. So you can certainly get back into shoes, get back to work after a couple of days, maybe 3 or 4, as Rachel just drops the camera, but we'll keep going anyway. So yeah, recovery is really quick, relatively pain-free as well. So if you're having trouble with them, by all means, you can give us a bell. So that's really all I wanted to talk about with you today. If you do have any questions for me, then please drop them in the comment box below this video, and I'll definitely answer them for you. And if you know someone who's suffering with ingrown toenails, or they might need some help, then definitely share the video with them, or feel free to tag them in the comment box below, and hopefully we can help them out too. So that's really all I wanted to talk about. Until we see you next time, take care, and we'll see you soon.
Hi, my name is Philip Vasili. I'm an Australian podiatrist and I've been in practice for over 25 years. Now I'm going to talk to you a little bit about orthotic technology, how these devices work, more importantly, how can they treat the common aches and pains that we suffer from heel pain, knee pain, and even back pain. Now as a podiatrist specialising in biomechanics, I've learned to understand how important the human foot is. We take between 5,000 to 8,000 footsteps per day on a very small unit which contains 26 to 28 bones per foot. So it is important that the foot is working correctly to prevent many of these common aches and pains that we do suffer from every day. When walking, our feet are the only interface with the ground. When we look at how the forces of walking can lead to common aches and pains, such as pain under the heel, pain at the back of the heel, and knee pain, one movement we are very interested in is called pronation. Pronation is the normal part of walking that happens every time we take a step. It is the movement that occurs during the period from the heel hitting the ground to the foot being flat on the ground. Now I'm going to talk to you about excess pronation, firstly what it is, and secondly how it affects the human body, from the foot through to the knee and even to the back. As you can see with Lauren, I've drawn a dot on her knee and also a dotted line down the front of her leg through to her ankle and to her second toe. If you look at this line, you'll see a curvature inwards. This is called excess pronation and it affects the majority of the population. Now this occurs because we're walking on hard, flat surfaces which causes our feet to roll over and our arches to collapse. Now as a podiatrist, what I want to see with Lauren's foot is this posture. As you can see, the arch rises, the knee realigns, and this line becomes a lot more straight. Now if Lauren holds it there, that looks correct, and it is correct. Now if I let Lauren relax her body, you'll see that her body rolls over. This is called the excess pronation. We get the rotation of the leg, which affects the knee, and also the muscles in the leg pull, and the feet collapses. Now this causes many aches and pains, much like bad wheel alignment on a car. It runs right from your foot, through to your shins, into your knee, and up to your back. So how can orthotic technology help? Our orthotic technology is shown to reduce overpronation, which can cause problems such as heel pain, knee pain, and even back pain. Now if we look at the line on Lauren's leg, you'll see it curved inwards. This is what we call excess pronation. Now if I place the orthotic device under her foot, which runs from her heel up through her arch to her forefoot, look at the difference. Very dramatic improvement of the line of the knee, through to the shin, the ankle and the forefoot. Even the height of her arch is improved. Again, if I take it out, watch the difference. Lauren's foot pronates again, which rolls in, causing the arch to collapse. The leg to rotate inwards, which strains the musculature here, rotates the knee, commonly causing knee pain and even affecting the back. Once more, we're going to show the correction with the orthotic device. And here we can see the perfect alignment of the knee, the shin, and even the foot. This technology is available in all of our orthotic products, and it is built right into our footwear range.
Hi everyone, it's Rachel here from Galleria Podiatry. I just thought I'd do a quick demonstration on how we dry needle for heel pain. I've actually had a few requests over the last week where some people are still a little bit hesitant or a little bit scared about what dry needling entails, particularly when it comes to heel pain. So I thought I'd do a demonstration for you, hopefully put your mind at ease. So have a look. So this is Kathy, one of our podiatrists. What we usually do is have a look at the calf muscle to start off with and find some trigger points. So I've already marked out Kathy's trigger points. So I'm just going to pop a couple of dry needles into those spots. So Kathy's not really going to feel anything. Just push it into the trigger. And Kathy might start to feel a little bit of an ache in the area. You feeling anything, Kathy?
Yeah, a bit of a tingle, sort of a heavy feeling.
Good. So if we get an ache or tingle, that's a really good response. That means that it's actually doing something. Oopsies. Sorry, we'll do that one again. That's better. Okay. So now we're going to move down to the bottom of the foot. And we're going to do the abductor hallucis, which is this muscle at the side, and then the quadratus plantae, which is the muscle in the arch area. These are 2 points that are key to getting on top of heel pain. Just going to do the abductor hallucis here. And then the last one is going to be in the QP, or the quadratus plantae. And that's it. It's that simple. So Kathy's nice and comfortable there. Normally we would leave the dry needles in for about 10 to 15 minutes. Occasionally we'd give it a little tweak. Just push it in a little bit further as the muscle relaxes. So what the dry needles are going to do is increase circulation to the area, and that helps with healing. It also releases a peptide, which is a natural pain response. We're getting awesome results with dry needling. If you have any questions, please comment below, and I'm more than happy to answer them for you. Bye for now.